Tuberculosis TB. What is TB? Tuberculosis, TB, is a contagious bacterial infection caused by Mycobacterium tuberculosis. It primarily attacks the lungs, known as pulmonary TB, but can also spread to other parts of the body, including the brain, spine, and kidneys. Let's discuss the most common disease caused by TB. That is TB of lungs. Lung TB, medically known as pulmonary tuberculosis, is the most common form of active TB disease, accounting for about 70% to 80% of all cases. It occurs when the Mycobacterium tuberculosis bacteria actively multiply inside the lung tissue, destroying tissue and making the individual highly contagious to others through the air. Let's discuss the features of reactivated tuberculosis. Active post-primary TB, also known as reactivation, TB. Post-primary pulmonary tuberculosis is also known as secondary or reactivation TB. It is an active, progressive form of tuberculosis that occurs in a patient who has developed prior immunity to Mycobacterium tuberculosis. It arises either from the reactivation of dormant bacilli from a past primary infection or from an exogenous reinfection by a new strain. Unlike primary TB, it is highly destructive, typically targeted to the upper lobes of the lungs, and is responsible for nearly 100% of human-to-human TB transmission. Let's discuss the chest X-ray of active post-primary TB, the reactivation, TB. Upper lobe infiltrates. These are patchy, cloudy, or poorly defined white shadows, consolidation. Most commonly found in the apical and posterior segments of the upper lobes, about 85% of cases. Cavitation. These are distinctive, thick-walled holes or cavities within areas of consolidation. This represents severe tissue destruction and indicates the person is highly contagious. Tree in bud sign, known as endobronchial spread. These appear as small, 2 to 4 mm, branching or nodular densities. This happens when the infection spills over and spreads along nearby airways.